Hi everyone, I'm Dr. Lin of Rehab and Revive Physical Therapy. We have Stephanie here for another segment of the knee series. This is incorporating what we just learned, what you just hopefully saw was the kneecap mobilization. We're moving towards strengthening. And one thing I do want to talk about is, some people just go on the leg extension machine at some PT clinics or chiropractic clinics or go straight to the gym, and they're pumping away and trying to build that strength. But is that really functional? Are we ever doing that unless maybe you're, kicking a ball? And that also incorporates the long lever. We like to think of short lever things. So something that's close, it's like holding a pail of water out here takes a lot more effort than holding the pail of water in here. So we want to stabilize what's closest to the knee and the hip joint first before we start venturing on to other things. So the knee curls, those things aren't functional unless you're wanting to kick your butt the whole time throughout function. And we don't really do that. So we want to do something more functional, and things like getting in and out of bed and bridging and all those things. Those are a little bit more important. So we got Stephanie here, and so Stephanie, what we're going to do is we've got this thing moving. Well, let's keep it in the right place, right? And so we're going to slide down here, and we're going to talk about the hamstring muscle a little bit more. I believe, and no one out there is really talking about this, but one of the hamstring muscles, the semimembranosus, does a great job in pulling the hip joint back in. And so we're just going to do a little quick test here and see if her hip joint is sloshing around first on this dysfunctional side. So go ahead and so she's doing actually a pretty decent job. It's keeping on axis if you see where that is, but some of you at home might be having a difficult job keeping that control. So that's where the hamstring muscle really kicks in. So right here is that semimembranosus on the medial side, the inside. Go ahead, and we want, as you're doing this, I want you to notice two things. I want you to notice, hey, am I using the quadriceps muscle? And remember we talked about the quadriceps muscle pinning that kneecap down. So that's why you want to start working the opposing side. So that hamstring muscle is the goal here. This looks like a regular movement to everybody else, but to Stephanie, I want her to start focusing on the hamstring and less here. So it should be about 80% down here, 20% down here. Now here's the way to get to this, and we're going to talk about this again. You can start here by having your foot flexed a little bit, and then pushing your heel into the table a little bit. And if what you can do is quick check, is this muscle? It looks like she's kicking that in quite well, but she's not really kicking here. So I'm gonna have you try to think about that, Stephanie, a little bit differently. Push that down, and now look at that, much softer. Of course, you're gonna use some of your quadriceps. That's natural. Like I said, this is this whole mechanism of straightening and extending of the knee has some rotation in it. So we do need that. So go ahead and drive that in, and what should be here is should be soft. 20% here, 80% here. And when you go down, you're gonna push this down. Once again, your cue is to check your hip. Dig this down. Make sure this muscle is, so you can even put your hand here to self-monitor. Right there is great. So if you have this dysfunctional side, sometimes it's that awareness. We want to build that awareness. Get that semimembranosus muscle pulling in. And what you might notice if you're also doing this correctly is that your core muscles are kicking in. And so when your quad muscles kick in, your core muscles don't necessarily come in right away. So now we're bridging that gap for these things to happen. Also notice you don't want to deviate too much, and you don't want your pelvis to move too much. So some quick pointers again, if you want to get this exercise correctly, right here is dig your heel down. Make sure you're firing the hamstring muscle first, avoid the quads, and then start doing motion. You're only allowed to go up as high as this hamstring is working, and you stop and don't go any further if this hamstring gets deactivated and you feel your quads. So these are some cues. Make sure you're not sloshing around your pelvis, your core is engaged, and your hip joint isn't sliding off axis and going up. So those are the goals here, to start getting everything on axis, get everything fine-tuned. And you want to be able to transition from going to flexion or bending and then straightening. And that's the great thing about this exercise. One of the toughest exercise for some of you at home to do, so do it diligently. Another way to make it a little easier for you, if you're having trouble with the carpet or the floor, is to use a little like a garbage bag or a grocery bag and stick it around your foot, and that takes away the friction. So you can see that Stephanie's having a tough time transitioning from flexion there and back to straightening, and that's partly because some strength and stability at the hip joint. So that's the goal. Get away from the quadriceps pinning that kneecap down. And then so the next segments we'll talk a little bit more about even building more strength and more strengthening, more awareness to this area. So yeah, how's that sound, Stephanie? Great. So there you go, Stephanie. Did you feel a little difference? You were wanting to engage and kick in that quadriceps, and so that starts creating that dysfunction of that kneecap again. So for those of you with runner's knee, this is a great exercise. But make sure you check with your healthcare professional back at home or wherever you're at. Make sure this is an appropriate exercise for you. Do it at your own risk. But that's the key, is start getting those hip joint and the knee tracking together, because it is the same bone. The whole femur is together. So we're going to keep delving into the next few exercises and either build on strength and endurance as well, and you can keep helping Stephanie out so she doesn't have such dysfunctional left knee. So thanks again, Stephanie, for coming in. I'm Dr. Lin, Rehab and Revive Physical Therapy. Remember, if you're new here and you like what we're doing, please subscribe below, leave a comment, leave a like as well, and we will catch you again. So remember, we can and we will get better together.